So one day, I wanted to do some exercise, and I wanted to show my mom if I was doing some planks right. And that's when she noticed a hump on my back. And the next day, she took me to the doctor, and that's when we found out I had scoliosis.
This is on.
Is it on? Yeah.
It doesn't even matter. I can do that. So about a year ago, well, when I turned 10, I was going to my annual doctor's appointment, and then they have you lean over, and they noticed that when I leaned over that there was like something with my shoulders was kind of off, so they took me to the doctor. They told me to go to another doctor, and then they found out I had scoliosis. So.
Okay, so it first started off when my mom would always notice that whenever I would wear a bathing suit that I always had like a hump or a hip higher than the other, and she just thought that it was lack of posture. But like the girl before, how she said it, how I went to a doctor's appointment and he made me bend over to see like my posture and everything, and he said that there was like a hump over, and he said that that could be scoliosis, like he said like forward. So then later on, my sister had a problem with her leg, and they first said that we had a leg longer than the other. And later on, they took us to go get x-rays, and they said that our legs were perfectly fine, that they were both the same measurements. And they wanted to check our back to see if we had anything with our back, and they found scoliosis. So, yeah.
Okay. All right, great. No, thank you for sharing that. I just want to make sure for my clarification, Christina, Izzy, and Alexis, right? Okay, good. I got it right. Just wanted to make sure. So, we'll open it up for questions, and, I'll go ahead and kick it off. I mean, we heard a lot about brace wear, right? And it's easy for me as a surgeon to sit up here or across from you and say, listen, go ahead and put your brace on. I know it can be challenging. I was wondering, for those of you that, have worn the brace, can you describe for us what some of your biggest challenges were and how you overcame those? Go ahead, Christina.
So, for me, my biggest challenge was when I got some rashes, because that would hurt a lot and it would make me feel uncomfortable. So, my mom took me to some dermatologists, and one of them recommended me a lotion, and that helped me a lot for my rashes and made me feel better.
Just a brace wear, rashes, dermatology, lotion to help wear it down.
The biggest for me was just going to school and having people ask you like the same question, like, what's that you're wearing? And for me, what I did, I got my brace over the summer. So for me, like one of the first days of school, I want to say, I went up to the front of my class and I was like, this is my brace. I have something called scoliosis. And then they kind of all got the general idea of what it was.
Gotcha. So basically talking to your friends early on, just letting them know, I've got scoliosis, this is my brace, and that helped you to, yeah, excellent, great.
I never wore a brace, so.
Yeah. So, any questions from the audience here? Thank you, Nick.
Thank you guys for coming up. It's great to hear the stories. I'm curious, when you, and this is for the parents as well, when you were first diagnosed, can you sort of comment on what the scariest thing that came across your head is after you heard the diagnosis, and then also sort of looking back at it now, how you met that challenge and what advice you might offer to anybody else in the audience who is dealing with similar concerns.
Great question. And for those of you that didn't hear, Dr. Fletcher is asking, what did it feel like when you first had your diagnoses, and what advice do you have for others that may be undergoing this? Right, Nick? Great. Go ahead. Why don't we go the other way this time? Alexis, you wanna start, or?
Oh, okay. I was overwhelmed because my first instinct was, I might need surgery, and anyone who hears that, that's frightening, and it could be a life-changing experience. But my advice I would give to others is to not be scared, because life happens, and you should just go with your gut, and everything will be okay.
Yeah.
So, yeah.
Go ahead, Izzy. Do you wanna?
For me, it was just I didn't. For me, it's just I didn't really know what it was, and I just didn't really understand that much. But now looking back, I probably had this really weird idea of what it was really going to be, and now looking back, it's really not as big as a problem as you assume it's going to be.
Great.
So for me, the scariest thing was probably if I was going to get surgery. But now looking back, like I always had my parents' support and my doctors, and yeah. And my advice is to not be scared and use the brace as much as your doctors tell you.
Excellent. Excellent. Good advice. We like hearing that. Yeah, it's a lift.
Yes, I had a quick question. So I understand when you first get the diagnosis, the scariest part is not knowing what to expect or what's going to come forward. So I wanted to hear from you guys, what's been the best resource to gain that knowledge? Is it your friends? Is it websites? Is it these books we hand out to you?
Yeah.
What helps you the most to get comfortable with that?
Great question. For those of you that may not have heard, the question is, once you have the diagnoses, what are the resources, friends, in the online resources? What are the resources that you're utilizing to help you? And why don't we open this up for both? We'll start with our patients, but also the parents as well, if you want to comment on that. Okay, Peter, do you want to start it off? Yeah.
So as it relates to Izzy and coming home and the questions we had, really some of the hard copy literature that we were able to receive was very educational for our family. And I think it can't be undersold, and I've seen it on a couple of slides already, is the new wardrobe. It sounds very silly, but as far as overcoming the apprehension around wearing a brace most of the day at school, are having a discussion around that, finding clothing that was comfortable, covered the brace, and really allowed Izzy to continue on with her daily activities was really strong. A really strong thing for us as far as overcoming some of the early apprehension in the, I don't want to wear this during the day, Dad. I don't want to wear it during the day, Mom. So that was very helpful for us.
Okay, so in our case, it was a little bit different. One situation, it's twins actually. It's Gabrielle who has had the surgery and Alexis who hasn't had it yet. A problem with her leg led to us coming to the hospital and finding out about the scoliosis. We had no idea. When they were 2 or 3, the pediatrician advised, they have slight scoliosis, but never made a deal about it again. We never even talked about it again until last year, about a year and a half ago. They were already 13 when they were diagnosed and suggested they needed surgery. I was the Google mom who was in shock when I was told that they were actually ready for surgery. I went home, rushed, went to Google. But for whatever reason, the team at Dr. George's office is extremely patient and knowledgeable, and they, reach out and call you and kind of calm the nerves. So I did the Google thing once, kind of read up on it, and then that's it. After that, I never even looked into any books or anything else. I just kind of called and texted Nicole about everything that I needed to know.
All right, anybody else? Again, go.
Yeah, we were in shock too after, I thought we were going to go to the doctor, get an x-ray, and they're going to say, she's fine, just go home, she doesn't have anything. I get to get so many questions on how to help her, especially, and we Google and we found the books that you were telling about, the Curvy Girls.
Yeah.
We ordered over Amazon, and I read it, and I thought that, she should read it because she was very nervous when she said about the surgery, what to expect, what she was going to do in her, her life was going to change completely. She thought that. The books helped her a lot, I think, and when we came to the doctor, Dr. Stephen George, she got many questions for him, and he answered them completely. I think he gave us a peace of mind, and we're following what he says, and she's doing great. I think she's good.
Very, very helpful. Any other questions at all? Yes, please, go ahead.
What advice do you have for me, for example, because my daughter is in denial, and she's like, "Oh, it's gonna be fine." I mean, what could she see? What could she? I don't know, websites of maybe wear the brace. This happens. This, just because it's such a short window.
Yeah.
That I think she dropped the ball a little bit, and then there was a huge difference in her her curve.
So how can we encourage compliance,
Right.
perhaps, with treatment?
Yeah,
or
like this is a serious thing,
Yeah.
and you have like 2 years to
it's
deal with it.
It's a great question, and I'll open it up for anybody on the panel who wants to take that. How can we encourage compliance, let's say with brace wear or exercise or whatever is being prescribed? And go ahead, Izzy.
Just knowing that in the long term it's going to help you a lot more, and it's better to suffer for the 2 years that you have to wear it. It's the truth. Suffer for the 2 years you have to wear it, and then when you're much older, you're going to look back and remember that you did that and it helped you a lot in the long term.
Yeah, really try to just think of it as a finite time as best as one can. Please, yeah, Kathleen, or Christina.
You maybe feel worried or sad or that the brace is not going to help, but it actually does. For my daughter, she's doing great. You have to use it. Like the other doctor said, if you don't use it, you're not going to get any. Probably, you're not going to see a difference. You have to make it for you. I think that she ended up doing this for herself. She was really worried about the surgery. I have to say yes. But now that she comes and when she sees the x-rays that, we're coming praying, the night before, we're so worried. But, if she uses and she comes back to the checkup and she sees that she's the same or even a little bit better, it could happen, I think that will give her the courage to continue. You have to do it for, you have to save yourself in this. You have to work and give the best of you. That's what I think. My advice is to do it and, work, do what the doctor says.
Excellent. Well, that was fantastic. I want to thank our panelists. And